Hey guys, Dr. Joe Rangel, the bodybuilding PhD. I'm a retired cop and a research psychologist specializing in men's mental health, trauma, and resilience. So, anxiety and depression. These are the two most commonly treated psychological disorders in the United States. It seems like anxiety and depression are everywhere. And nothing I'm about to say should in any way replace the advice of your licensed clinical therapist, but this is just some perspective from somebody that maybe will help you, maybe it won't. So first of all, anxiety and depression can exist in the same person. That is absolutely possible, and that sucks, right? Because you're worried about the future, but you're also depressed about the past, and you go back and forth between the two, and it's great. Thing is this. Anxiety generally, not always, but generally tends to pull you into the future. I'm worried about something coming. I'm worried about what's going to happen. I'm worried about, I have fear about this happening to me. And depression tends to pull you into the past. I'm sad about that event. I lost everything. I'm a loser. I have shame. I have whatever about whatever went on back there. Even if it was trauma, happened back there. So the problem with both of these disorders, at least from a philosophical perspective, is that they steal you out of the present, which takes away your ability to feel joy and happiness and the good things going on in your life right now, or even be productive right now. There's two things I want to introduce to you, and they're really kind of the same thing, at least at their base. Cognitive behavioral therapy is a very well clinically researched and clinically effective version of therapy that basically focuses on getting you to think right. And what I mean by that is the idea is that there are things that are in your control and things that are not in your control. And when something happens, if it's not in your control, the only thing you do control is how you react to it. And then the philosophy of Stoicism, and this goes back all the way to ancient Greece and then later ancient Rome, and it's really misrepresented on the internet. It's very popular right now, but I see a lot of quotes that are not really Stoic quotes, because people get Stoicism confused with the word stoic, which means being feelingless, emotionless, passionless, like a rock. It's called Stoicism because it was taught in a stoa, which is a type of architectural feature in the ancient world. So the people who learned there were Stoics, okay? Not the same thing. The idea behind Stoicism is that you must be grounded in the now, and that worrying about the future is pointless, and worrying about the past is pointless. And so the Stoics have all these different techniques and philosophies and mantras and stuff they use to try and keep themselves grounded in the right now. So you can see the similarity between the two. In fact, there is argument that CBT got some of its ideas from Stoicism. I don't know enough about Stoicism to be able to tell you that's the truth, and I'm certainly not an expert, I'm just a student. But I will tell you this. If you are dealing with anxiety in your life, be it anxious attachment, post-traumatic stress disorder, generalized anxiety disorder, or with depression, first of all, seek clinical help. But secondly, as you're trying to mitigate this stuff in your life, consider trying some of the Stoic principles. Go research Stoicism a little bit. Consider seeking a CBT therapist, because when you are grounded in the now, when you are perceiving the stress coming in, saying, oh my God, this is terrible, how am I going to react to it? That is the exact same thing that I've been trying to teach you with respond versus react. Put that beat, right, between your stimulus and your response. Even if it's something in the past, those bad memories come up, we try and put that beat in there and reinterpret them. Again, you may need the help of an actual clinical therapist, or your religious mentor, or somebody else, but just something for you to consider. Check out Stoicism, check out CBT, see if it can help you. Either way, stay here, stay now, because this is where the good stuff is. All right, guys, I'm Dr. Joe Rangel, the bodybuilding PhD. I love you.